You're live.
Good? Mm-hmm. Good? It's like, camera. Hey guys, it's Dr. Emer. We're finishing up, and I know everyone across both coasts are watching because it's bedtime on the East Coast and it's nighttime and dinner over here. And we're doing some facial sculpting today for staff. And we have our beautiful model here who is going to... Is this your first treatment? First treatment of filler ever, which is great because we're using all hyaluronic acid or sugar-based fillers for the Juvederm family products. And we're going to use kind of a variety here to just do the subtle facial enhancements that women like. Cheek elevation, softening of the under eye, improvement around the mouth and chin. Those things just make people's features pop. If you use fillers to try and lift the face, often people look overdone. That's because you can't use volume to lift. You can in subtle instances like here where we're going to try and just lift slightly to improve a fold, but it's not going to lift a jaw, it's not going to lift a face. So we have a young person that's going to have subtle bits of the filler to give her facial enhancement. That's what we're going to use. So we're going to first start with Voluma, which is one of our favorite Juvederm products. You can see it's nice and smooth. The reason we like it is because it's indicated for mid-face and it gives a nice soft cheek enhancement. We're going to follow her cheekbone. We're going to go right on that bone. We typically go in a line, brow to nose, right on the bone, and we're just going to do little bits, little aliquots. Now, depending on how substantial someone wants their cheeks to be, we can always do more, but I want her to feel comfortable. Start out slow. And we're going to go right onto the bone and just do little aliquots. And you can see with Voluma, look how quickly that rises up, okay? Because this is the premier mid-face filler. Now, with her, she has a bigger tear trough because her cheek fat pad's very low for her overall facial shape. So we want to do a little bit to try and lift that. So we're going to move a little bit more towards her mid-face and inject more towards her mid-face and trough to give a little bit of lift there, and come back a little more laterally to give a little bit of pull. Good.
You could already see a difference.
Oh yeah, that's what we want. Want it to look nice, but be something she can appreciate.
Abby says, oh, sorry.
Who?
Abby says,
my
hi,
sister?
Joe. Yes, your sister.
Hi. So what we're also doing here is I'm doing a special technique that struts underneath the fat pads to give a little bit of lift. A little bit lower. My sister's favorite treatment is this. Okay, so now I'm going to have her hold right here, nice and firm. Perfect. We'll go to the other side. Perfect.
How's it feel?
Not the best thing in the world.
It feels fine. My eye just got really watery.
Everyone seems to water. So again, we're following this line, starting laterally.
Keep your little wing there.
She bleeds very easily. Doing little aliquots. And remember, because we want to give a little bit of this mid-face elevation, we're going to go a little bit towards this under eye area, her cheek fat pad. Okay. Hold still one sec. Just going to hold a little pressure just to keep it so swelling goes down. And remember, you guys, everyone always says, oh my God, 2 or 3 syringes. You know, 1 syringe of filler has a very small amount of volume. And so it's really important that you, when you're deciding on how you want to do treatment, you determine it based on the area, not on the syringes. Okay, so now let me take a look. When we balance out, let's see, Oh yeah. When you balance out the cheeks, already take a look, turn to the side a little bit. Look at that enhancement.
Beautiful.
And look at the side here. Look at that enhancement. Now, to give her that contouring and to projection, we're going to do a little bit of it now with the chin. So if we turn her to the side, her chin actually matches relatively close to her nose, to her lip, to her chin ratio. But by projecting this just a little, it's very subtle. Okay?
Mm-hmm.
Good. This subtle improvement is going to make her cheeks look more enhanced.
What filler are you using for her chin?
We're going to still use the Voluma because we want to balance everything out. Turn to me a little bit. Perfect. Now, some people widen the chin. We don't want to do that on her. We want to keep her chin projected. Okay. Hold that for 1 second. And then remember I said before, when you evaluate, let's take a look. The chin, you want to make sure you don't forget this little area right here to soften it all. Because this is the area that starts to fall. Good. Now, if you take a look at the main architectural improvement, cheek and chin, we now have really restructured part of her face. So the last two things. The last two things that I think give a big improvement are the under eyes and the lips. Her lips look great already, similar to the last woman. All we want to do is just slow, subtle improvement. This needle's too big. Hold on. Can you guys bring me a 30 gauge needle, please? Oh, wait, never mind. I have one.
People are saying, she looks so good.
Are they asking anything?
Would it be okay to add filler in the temples in a few weeks?
Sure, you can do it even now if you wanted. So we're going to enhance her lip shape by doing just small little pillars, and we're using, again, the Juvederm Velour because it's nice and soft. Now with her, we don't want to create a big pillar because she doesn't have those naturally. And her lip is naturally asymmetrical. So you want to kind of balance that as much as you can, but not overly do the symmetry.
How long does velour last?
About a year, sometimes longer.
Can you use Voluma in the lips?
You can. You could use it anywhere. Just it's going to be a little bit of a different feel. Let's see how we're doing. Very small bits to balance everything. Softening, softening. Just doing great. Let me see from the front. Hold on. Give a little bit more eversion. I promise. I'm poking her a lot. And she's going to be very swollen right now because we're doing so many pokes. But the end result will be great. In a few weeks. Sorry.
How can you enhance the results of the lip filler?
You can use a lip plumper, is what we like, Lucy & Co. Let me go a little more superficial. So let's outline a little.
Besides size, what else can you use fillers for?
Fine lines,
Symmetry, fixing the symmetry.
symmetry, enhancement of facial features. Let's see. So now we're outlining, because she naturally has an asymmetry that makes it look like it's unbalanced. Now if you take a look, the outlining is enhancing that. Let's see. Good, basically done. So with her lip shape, we want to make it as best as we can, and then we enhance more later if needed. But we need to do a lot of pokes on her to get that done right. Let me see. Good. That's really good. It's all soft, very natural. And then the last part we want to do is her eyes. And take a look, you guys. The 1cc Volbella has just come out not too long ago. And we typically will use this in the lip area and around the mouth. But for her, since she has a very low set eye and we want to soften that area, we're going to use it there. Now, with the Volbella, the cool thing is it's a little baby needle. We call this the Gucci needle. It's so little that the very minimal pain. So I'm going to do one little part, and we're going to go right up into that trough area. And again, with Vicross technology, you're going to have a little longer of an effect. So you want to go really slow and just do very small amounts and go right up into there.
What's the difference between using this needle and a cannula?
Well, cannula is less likely to bruise and be less painful. With the needle, I can be more precise. Now I'm going to hold pressure on this side because the most important thing is that we hold pressure. Now my PA Danielle is going to do the other side. And again, very small amounts directly into that trough area will balance what we did in the cheek. What do you have to say about the under eyes?
I love treating the under eyes. I think it's one of the areas of the face where a little volume really goes a long way. It doesn't take much, but it gives you such a nice, refreshing appearance. Typically, it's an area that patients don't realize can be improved upon. They want to come in, just feel like they look tired, and it's a quick fix when you have a skilled injector. And it's somewhere that to me, when it comes to filler, it's a good place to work because it's going to balance through the cheek, kind of the area that people tend to focus on, and it's somewhere that filler lasts quite some time. So I feel like it's a really great investment into your overall appearance.
Most young people come in saying they have, hollow eyes or dark eyes. They feel very tired looking. So we use filler, and we like Volbella here because it's soft and it lasts a long time. We've already lifted the cheeks with Voluma. This will balance everything out. Now, since she's a bleeder, it's good to hold pressure because that's typically what stops bruising and decreases the swelling.
Look straight ahead. Looks good.
Now, one place a lot of people forget to treat is right on the corner of the eye. And this area, as we age, starts to become hollow. So we want to balance everything here. Just go right down and treat that area. Come over here.
What is this-
Pressure for her, and then I'll
What
do
is the
other
filler
side.
you're using for under eyes called again?
This is Volbella, Juvederm Volbella in the 1cc syringe. And again, right here, you could see that little hollow area. So we just do a very subtle bit. Perfect. So that's really it. Now, she'll probably have some bruises because we did lots of pokes. But let's show her at least. We're going to hold those little bruising areas. Hold right there. A little bit of pressure. Good. And then we're going to show her the outcome. We'll have her
Awesome.
pretend she doesn't see any of the bruises. But other than that, what do you think?
Yeah. I love it.
So look at the chin, just a little projection, softening of the lip, and then ignoring this and that, a little lifting through there. But look at the under eyes. How much more improved.
Yeah. I really
know?
love the cheeks.
Oh, the cheeks are going to look so good. Let's see this side because it's not as bruised, but you can see the elevation, which is going to give her more of that contour. It takes somebody that has a wider face and it makes them look more narrow. So it's perfect. So that's female facial sculpting. You're going to want to see her in